So we are going to just start discussing the arteries of the head and neck. And what you'll see is there's just a bunch of them. It's a very complicated area. So I'm dividing them up a little bit. So in this video, we'll be discussing the common carotid artery and how it splits into internal carotid, external carotid, and then the branches of those. So our objectives in this video are going to be to describe the origin, termination, course, and anatomical relations of the common carotid artery. Also, you will describe the location, function, and innervation of the carotid sinus and carotid body. You'll describe the origin, termination, course, and anatomical relations of the external carotid artery and name the branches of the external carotid artery briefly and describe the territories they supply. The common carotid artery is going to originate asymmetrically between left and right. So the right common carotid artery you see right here, and it is originating from the brachiocephalic trunk. But the left common carotid artery, I just want that to be one word. I guess I'm just trying to get through this video. The left common carotid artery you see here is originating directly from the aortic arch in the superior mediastinum. So it's going to originate more inferiorly than the right common carotid artery. And then after they originate on both sides, they're going to ascend within the neck within a carotid sheath to the upper border of the thyroid cartilage, which you can't really see in this picture, where it will divide into external and internal arteries. So you see here the common carotid artery. This is going to be the right common carotid artery C because it's coming from the brachiocephalic trunk right here at about the level of the upper level of the thyroid cartilage. It will divide into external carotid, which is going to be more anterior, and internal carotid, which is going to be more posterior. So here in this picture, do you see this tiny, tiny yellow dot? Tiny. I mean, it's if you were going to see it on a cadaver or on a person, it would be only about 2 millimeters in area, like just a very few millimeters. This is where we can find the carotid sinus and body. So it's going to be at the terminal part of the common carotid artery and at the beginning of the internal carotid artery. There's going to be these two things that we'll see. So first thing we're going to see is this little dilated part of the internal carotid artery. And this is going to be known as the carotid sinus. And right here at the carotid sinus, you're going to see the wall is going to contain numerous nerve endings. Most of those nerve endings will be coming from the glossopharyngeal nerve. And all these nerve endings are going to be sensitive to changes in blood pressure. So baroreceptors and pressoreceptors. I've got them more enlarged. So here you see the carotid sinus and all the nerve endings that are going to be located right there. And then right next to it, that little tiny, tiny thing, this is the carotid body. So this is highly vascularized, oval in shape, and it's going to be posterior to that bifurcation of, well, my mouse isn't working. Hold on a minute, guys. I don't know what's going on with my mouse. I'll just use the little finger mouse that's on the keyboard. So the carotid body is going to be just posterior to this bifurcation of the carotid, common carotid artery. It's going to contain nerve endings that are also just mainly derived from the glossopharyngeal nerve, which will respond to chemical changes in blood composition. So oxygen and carbon dioxide levels, blood pH, those type of things. So chemoreceptors. So remember, the carotid sinus had baroreceptors and pressure receptors. The carotid body will contain chemoreceptors. And these together will be important in the reflex control of the heart rate, blood pressure, respiratory rate, and depth. So here's the external carotid here. It's going to supply most of the um, uh, neck and face. So it's going to have many, many branches. Whereas we see the internal carotid artery here, it's going to have no branches in the neck and just be making its way straight up to get to the brain. So the external carotid artery, as it begins at that upper border of the thyroid cartilage, it's will give off numerous branches, and they can be grouped. Well, we can see the list here. You've got all the branches, but they can be grouped as anterior, posterior, and medial branches. So the anterior group is going to be the superior thyroid artery, the lingual artery, and the facial artery. The medial group is going to be the ascending pharyngeal artery, the maxillary artery, and the superficial temporal artery. And the posterior group is going to be the posterior auricular artery, the occipital artery, and then sometimes this tiny little sternocleidomastoid artery. Or not tiny, but it doesn't always come off the external carotid artery. And what we see here is all these structures here would have been running in the carotid sheath, and it's has been removed, and kind of hooking or pulling back the internal jugular vein and the vagus nerve and the internal carotid artery here. So this is an important, as these structures are traveling within the carotid sheath, this internal jugular vein would be lateral to the common carotid artery. So that's why it's having to be pulled back. And then the vagus nerve is going to be between, so lying in between these two, but posterior to the common carotid artery and internal jugular vein. So the external carotid artery, as it ascends you'll find it in the carotid triangle, and as it ascends within that carotid triangle, it will exit the carotid triangle and pass deep to the posterior belly of the digastric, which has been cut. So here's the posterior belly of the digastric. You can see it's just gone. The external carotid artery would have passed deep to that, and then also deep to the stylohyoid, which you see right here. And then it will end up terminating into two terminal branches, and that's going to be the maxillary artery, which you barely can see right here, and then the superficial temporal artery. So the external carotid artery will end in two terminal branches, and that's the maxillary artery and then the superficial temporal artery. And we'll talk a little bit more about those in just a second. But if we start at the most inferior part, so now it is bifurcated into external carotid and internal carotid, the first branch that we're going to see is going to be the superior thyroid artery, which is right here. It's going to descend almost vertically down towards the thyroid, and it'll be accompanied by the external laryngeal nerve to reach the superior pole of the lobe of the thyroid gland and contribute to the blood supply of the gland. It'll give off the superior laryngeal artery, and that superior laryngeal artery, which you see right here, will pierce the thyroid membrane, which you see it's piercing right there, with the internal laryngeal nerve. So you can see the internal laryngeal nerve if you look really closely at this picture, traveling right there with the superior laryngeal artery. So with the superior thyroid artery that is going to originate from the external carotid artery, then just travel pretty vertical to the external carotid artery and inferiorly, and it'll give off the superior laryngeal artery, which will pierce the thyrohyoid membrane with that internal laryngeal nerve. So your notes do list off several other branches of the superior thyroid artery, but the one I want you to know most about is the superior laryngeal artery. So you can just read about the other ones. You're not going to be tested on those. So if we keep traveling superiorly, the next branch that we are going to see is the lingual artery, and here is the lingual artery right here. The lingual artery will originate from the carotid artery, and it will usually be opposite the tip of the greater horn of the hyoid. So in this picture, we don't see the hyoid. Let me see if you see it in the next. Yeah. So this picture, we've kind of just taken away a lot of the other muscles. So we see the common carotid artery, and here it's giving off the external carotid and internal carotid. You have the superior thyroid artery that we just talked about, and then you have the lingual artery right here. And it's just opposite the tip of that greater horn of the hyoid, which you see right here. And the initial segment of the lingual artery is going to be crossed by the hypoglossal nerve. So we could see the hypoglossal nerve right here. I think that if you're trying for reference, I don't think they have it labeled, but that's all right. So it's going to be superficial and lateral to that lingual artery. It'll also pass deep to the hypoglossus muscle, which we talked about when we talked about the tongue. You can see that right here, and make its way to supply the tongue. So as it enters the oral cavity to get to the tongue, it'll pass deep to the hypoglossal muscle and then supply the tongue. So key things to know about the lingual artery is that it's going to originate from the external carotid artery opposite to the greater horn of the hyoid bone, and then it is going to be crossed laterally and superficially by the hypoglossal nerve, and then it will pass deep to the hypoglossal muscle to supply the tongue. As far as the rest of its branches, I'm not going to test you on those. And so you can, they're for reference in your notes, but those aren't going to be as important to know. So then if we keep traveling, the next branch, well, not really, not that we are going to keep traveling. I would say rather we're going to move to just a little different part of the common carotid artery, and start talking about the facial artery. So if you remember, this is still going to be part of the anterior group. So we talked about the superior thyroid artery, the lingual artery. Now we're going to discuss the facial artery. The facial artery, you can't see super well as it comes. You see just a tiny bit here, and then it's going to continue on like this and be pretty squiggly on the face. Okay. So there's the superior thyroid. Here is the lingual artery. Now we're on to the facial artery. It will be originating immediately above the lingual artery. Sometimes it will even just have a common trunk and then originate. But for our purposes, it's going to just originate just immediately above the lingual artery, and then pass medial to or deep to the posterior belly of the digastric, which, if you remember, has been cut away here. And then it'll pass deep to the stylohyoid muscle and submandibular gland. So you would have submandibular gland in this area. It's been removed because this artery will pass just right through it. It'll curve around the inferior border of the mandible, and it'll be anterior to the masseter muscle. So you can't see the masseter muscle in here, but this will be just superficial to the masseter or anterior, and enter the face. And this is a place where you can actually feel the pulse for the facial artery. So if you clench your jaw and feel for your masseter, the facial artery will be located superficial to it, and you can try to see if you can get the pulse of your facial artery, or you could try to do that on someone else. Just have them clench their teeth, and you can feel for it. And then this is going to be the main source of the blood supply to the face, and it's also going to supply the palatine, tonsil, and submandibular gland. So it's going to have more branches, but again, I'm just worried about you knowing the facial artery and how it branches from the external carotid artery. So those are our anterior group. So superior thyroid, which is going to travel inferiorly and give us the superior laryngeal artery that will pierce the membrane of the thyroid cartilage. I don't know why my words are just not with me today. I guess I'm feeling the end of the trimester as well. Then you'll have the lingual artery that's going to be crossed by the hypoglossal nerve and pass deep to the hypoglossal muscle to supply the tongue. And then you'll have the facial artery. Now, if we go back to those groups, if we discuss the medial group, that's going to consist of the ascending pharyngeal artery and then those two terminal branches of the maxillary artery and superficial temporal artery. So first, let's talk about the ascending pharyngeal artery, which you see right here. The ascending pharyngeal artery is actually going to be the smallest branch of the external carotid artery. So ascending pharyngeal artery is the smallest branch of the external carotid artery. And it'll ascend along the pharyngeal wall toward the cranial base, and it's going to be medial to this internal carotid artery. And so just as the name implies, ascending pharyngeal artery, it's going to ascend along the pharyngeal wall towards the cranial base, and it'll be medial to this internal carotid artery. And this is going to contribute to the blood supply of the pharynx. So I'm going to skip the next two medial branches, the maxillary artery and the superficial temporal artery, and talk about the posterior the posterior branches of the artery. And that's just if we're looking at how where they are relative to where they're branching, it helps us kind of just see these lower ones before we get to the terminal branch. So the superficial temporal artery is going to, not superficial temporal, I meant occipital artery. I just said I was going to skip over the superficial temporal, and then I just went right to it. So you see the occipital artery right here. And the occipital artery is going to be originating from the posterior aspect of the external carotid artery near the origin of the facial artery. So this one is showing it a little bit lower, but it'll be somewhere in between the origin of the facial and the lingual artery. We'll see the occipital artery, and it'll pass posteriorly and then superiorly. So it's going posterior and superior, kind of this direction. Again, it's going to be deep to that posterior belly of digastric, which has been cut away, and also the mastoid process. And then it'll reach the back of the scalp. And then its terminal branches will accompany branches of the greater occipital nerve, um, and supply the posterior part of the scalp. So um, uh, you can see it's going to make its way, and you see more of it up here. So this is going to be the terminal branches up here. So also from this occipital artery, you're going to have the sternocleidomastoid branch. The sternocleidomastoid branch will sometimes originate straight from the external carotid artery, and then other times it'll just originate from the occipital artery. It's going to be a pretty small branch. You see it right here. So this picture is showing it just originating from occipital artery, but it's thrown with the posterior group of the external carotid artery just because it will arise from the external carotid artery more too, I say, but mainly know about this occipital artery. And then the posterior auricular artery. The posterior auricular artery, we see, if we continue up, the posterior auricular artery will arise from, again, it's in the posterior group, from the posterior aspect of the external carotid artery, and it's going to be above the occipital artery, and it actually will run almost parallel with the occipital artery. So here's the occipital artery, and then here is the posterior auricular artery. So it's almost parallel with the occipital artery. And then you'll see it pass posteriorly and superiorly, just like the occipital artery, and it'll reach the ear, and it's going to travel behind the ear, as the name implies, a posterior auricular artery, and supply the auricular artery, or supply the auricle and then the scalp behind the ear. So you had the posterior auricular artery supplying the scalp and the ear, the auricle, and then you had the occipital artery that's going to be supplying the posterior aspect of the scalp. Now, let's finish. That was the posterior group. So posterior group's going to contain the occipital artery, that sternocleidomastoid branch, and the posterior auricular artery. And then we'll look at our two terminal branches, which is going to be the maxillary artery and the superficial temporal artery. These are grouped in the medial group, right? I'm just talking about them now because they're terminal branches. So let's talk about the superficial temporal artery first. It's just going to be an upward continuation of the external carotid artery. So you just see it traveling superiorly. It'll travel anterior to the ear, or with the auriculotemporal nerve, which you don't see, and superficial temporal vein, which you don't see in this picture. It'll pass superficial or laterally to the zygomatic process of the temporal bone. So this is going to be where a pulse of this artery can be felt. So if you find your zygomatic process of the temporal bones, if you find, your cheekbone, this will be a place you can palpate the pulse of the superficial temporal artery. And then as it crosses that zygomatic process, as it gets superior to it, it will divide into anterior and posterior branches, are also known as, those are the frontal branches and the parietal branches. And it will supply the frontal, temporal, and parietal regions of the scalp, and contribute to the blood supply of the face. I just want you to be concerned about how it splits into the frontal and parietal branches, but not necessarily know about all the other branches of it. Now, the last, but certainly not least, artery that we're going to talk about is the maxillary artery, which is the largest branch of the external carotid artery. So it will pass anteriorly. So you see it branching, and it's going to be deep to the neck of the mandibles. That's why we don't see it here. And then it'll run through the infratemporal fossa and terminate in the pterygopalatine fossa. So here we've got everything kind of stripped away. You can see the maxillary artery right here. Here we go. So now we've got the external carotid artery, and we're seeing just the maxillary artery right here. So very large. It's going to have 3 parts and give us a ton of branches, as you can see, because it's going to supply the upper and lower jaws, the muscles of mastication, the nasal cavity, the palate, and the meninges, okay? But for our purposes, what I want you to know is that the maxillary artery is going to be the largest branch of the external carotid artery, and how it's going to pass anterior and deep to the neck of it will pass anteriorly and then deep to the neck of the mandible, and give us off many, many branches to supply the upper and lower jaws, the muscles of mastication, the nasal cavity, the palate, and the meninges. But you do not need to be concerned with being able to identify all of these other branches. I want you to just be able to identify the maxillary artery. And here we see the common carotid artery. And then we're going to have that right, the internal carotid, and you'll see it just traveling through the brain, and we're getting up to that circle of Willi. So it's going to contribute to the circle of Willi. With this, we should be able to describe the origin, termination, course, and anatomical relations of the common carotid artery. We also talked about the location, function, and innervation of the carotid sinus and carotid body. You should be able to describe the origin, termination, course, and anatomical relations of the external carotid artery, and name the branches of the external carotid artery, and briefly describe the territories they supply.